Okay, so we're discussing again the oral childhood rape, and we're looking at the family's behavior in this one. Patients who have a family psychodynamic in relation to neglect and punishment roles cause PTSD and simultanagnosia dysfunction. The environmental aspect is a disruption. And it can become hereditary. Without treatment, a patient may turn into, like I was saying earlier, a psycho killer. And so we don't want psycho killers. And so we're trying to prevent these things from happening, and or a really abusive person that might harm, later on in life. And so without treatment, you know, the, we have to take really serious preventative measures, in order to safeguard the public, basically. And so the biological behavioral analysis on family systems helps a therapist to change the neuronal structure in a memory and replace old bad memories and behaviors and implement new positive actions and produce productive energy towards a good life. So we're trying to, really show them that, even through, like, with flashcards, giving them, like what life is supposed to look like a tree and age appropriate toys, like chutes and ladders, and, or some other, fun games, teddy bears, things like that, that make them understand, like, maybe there are really neat things in life, like dolphins and fish and all of these other really cool little things. So we want, like, to take the child and reprogram their brain and let them know, like, there is safety. And so we want to invest a lot in putting forth that effort, to help the kids and to help adults who've been through it too, and teaching them all of the cool things, like, even working at, who knows, a shoe store might be really cool, learn a lot about different kinds of shoes and what they're, like, designed after, and who, and what kind of celebrity is this shoe for, but, like, things like that instead of things like rape. So what we're trying to do is, like, reprogram their brain and make them like happy people. And that's the goal. And then also another little piece about the family is sometimes the family is the reason that it happened or was the one that did it. And so sometimes what we really want to do is limit those interactions or remove them completely, and take the children completely away from that person, just in case they're detrimental to the child's life. And, those are, just in case the disease would undergo inoculation. So helping in designing a plan to reduce family influence or social influence, resulting in said criminal action against either the child or whatever, or against the adult that has grown up into a person now and is doing the wrong thing. So we're trying to limit family interactions if they're dangerous. That too, it's something that's very important to recognize. Family is not always the end all. Sometimes they're the problem. So we really want to take that into consideration. Anyway, so that's what we do have there.